Hi, I'm Dr. Marcia Sirota, and today I want to talk about pop psychology and how it doesn't help us to be spouting all these psychological terms unless we have a really clear understanding of what they mean. So the very well-known relationship expert Esther Perel was recently interviewed in Vanity Fair magazine about psychobabble and pop psychology. And what she was saying is that it tends to alienate people because they get hung up on one category that they belong to psychologically, and then they create these divisions between themselves and each other. And I wanted to comment on that because I have been rather opposed to psychobabble from even before I was a psychiatrist. I've been in practice for decades, and I think that it's very, I wouldn't say dangerous, but very tricky for us to talk in these terms because so often we bandy these terms around without a deep understanding of what they mean, and we can weaponize these terms. We can use them as attacks, or we can use them to shut down conversations. These are things that Esther Perel mentioned in her article. And we can also just misuse them and misunderstand them. So we're saying something and we don't really even mean what we're saying because we don't have a clear understanding of what these terms are. So we can label people, we can label them with terms, you know, this person is borderline, or this person's a sociopath, or this person's a narcissist. And what happens is that these terms, because they are diagnostic terms, they should not be used by lay people who are not, you know, trained clinicians. However, because they are pejorative terms, the person on the receiving end has now been attacked by undermining their mental health. So, you know, basically they're called crazy, they're called bad, and, you know, whether or not the person calling them those things actually has an understanding of what these terms mean, these people on the receiving end are now labeled as borderline or antisocial or narcissistic, and it's not fair. So I would recommend that we be very careful about bandying these terms around unless we actually understand what they mean and we understand the diagnostic criteria for each condition. These are all medical conditions, and just as you wouldn't go to a person and go, oh, you know, I think you are suffering from renal insufficiency. How would you know? Because you haven't examined them, you're not a physician or a nurse practitioner, you know, then how would you know if someone has a mental health condition if you haven't examined them and you're not a mental health practitioner? So be careful about diagnosing people when you are not a professional, and be careful about labeling people in a way that actually hurts them and hurts their reputation. The other thing is, it is alienating. I do agree with Esther Perel, because when we say, okay, for example, like she said, I have a difficult attachment kind of personality, I'm avoidant in my attachment, or I'm dependent in my attachment, then we are also separating ourselves from those who don't have that kind of attachment style. And so, you know, all the people with X attachment style can't relate to people who have Y attachment style, but maybe that's not the full truth about ourselves. Maybe it's not even any truth about ourselves. We have to be very careful about labeling ourselves in a way that puts us into a box, because it is alienating, it is divisive, it does separate ourselves from each other, and I don't think that's a really good idea. I think that we can use psychological terms and psychology in general to have a greater understanding about ourselves, about our motivations, about our history, about why we behave in certain ways, about our tendency toward addiction or toward depression or anxiety. It can be very helpful in helping us understand ourselves and each other, but we have to be very careful about creating these categories that we cannot escape from for the rest of our lives. We are always going to be an avoidant attachment style or a dependent attachment style. Well, because that's not true. We change, we evolve over time. We evolve because we grow up, we evolve because of our life experiences, and we evolve because we are getting help and we are doing the work to evolve. So saying that this is me, this is my box, and I'm going to be in it forever is very limiting, and it's very unfortunate. So it's alienating, it's limiting, and it's often incorrect, because as we are studying these things, we may not have a true understanding because, you know, we don't have the experience. Now, obviously, some people are more psychologically minded than others. Some people do have a capacity to really understand psychological concepts very well, but even these people have to be careful because, like I said, we can weaponize these words, these terms. I personally do not diagnose people who are not my patients or who are not people I'm doing a formal assessment of. I tend to, steer away from it because I think it's very dangerous. Now, on occasion, I will write an article about a politician in the public eye and I'll say, boy, they seem to be X, Y, or Z. But even then, I'm not really diagnosing them because I can't say I know for sure. So I can say, they certainly seem to have these traits, but I don't know because I haven't examined them. I'm not their doctor. I don't know. So I think it's very important that we recognize that diagnosing a mental health condition should only be done with the consent of the person being diagnosed and by a qualified professional who has the training and the experience to know what they're talking about. We should refrain from diagnosing each other. I think it's very dangerous and I think it's very alienating. When I did group therapy, I had 12 people coming week after week, and one of the rules was we don't tell each other you are X or you are Y, and we don't ask each other therapeutic type questions. Well, they didn't, I did because I'm a therapist, but they weren't allowed to therapize one another because that's a boundary violation. They could share how they felt, they could share how they related to each other's experience, they could talk about what was going on for them, they could give empathetic, supportive feedback, they could express anger in a positive, constructive way, but they weren't allowed to ask the kind of therapeutic style questions that only I could because I was the therapist that they had contracted to work with. I was the only person qualified in the room that they had given consent for to ask them those kinds of questions. So we have to respect one another's boundaries as well when we use these terms. And when we diagnose people, we violate their boundaries aside from alienating each other and becoming, perhaps weaponized. So let's take a step back. We can use psychological concepts to understand ourselves and to also have more compassion, because if we understand, gee, my childhood trauma has informed some of my current addictive behaviors, then we can help ourselves by addressing the childhood trauma so that we could hopefully reduce some of the addictive behaviors. But we don't want to say, I am a victim of childhood trauma, that is my identity, because then we get stuck in a trap. I have always shied away from encouraging my patients to identify as victims of anything, because I don't see any of us as victims of. I see all of us as having had life experiences. We've had some good ones, we've had some terrible ones, and we need to understand how these experiences have affected us, the impact of each experience for the good or for the bad, and how perhaps some of our choices moving forward have been affected by these experiences. But if we call ourselves, I am a victim of X, then that limits us to just this one thing that we are. And we are so much more than whatever things happened to us. We are also what we love, what we believe in, what we're passionate about, what we do, where we've been, who we've connected to over the years. So when we say I am a victim of X, it's kind of diminishing to us. So we need to use these psychological concepts to help understand ourselves and each other better without getting stuck in any boxes or putting anyone else in a box. We can avoid diagnosing each other because that's a boundary violation, and we certainly should avoid weaponizing terms by name calling people because we are not equipped to make such a determination. And even myself, with many years of training and experience, it's not ethical to diagnose people who I have not received their consent to do so. So without consent and without that relationship, that professional relationship in which the person has said, yes, I need you to help me understand myself better, we should refrain from labeling anybody. And remember, labels are just there to help us understand. They're not the whole of us. They're not the entirety of us. We may be someone who experienced some trauma. We may be someone who's experienced some issues with addiction. We may be someone who has certain kinds of behaviors, but that is not the entirety of us. And when we reduce ourselves to just one little thing, one little label, it's really unfortunate because there's so much more to all of us than just that. So let us have a little bit more perspective on popular psychology. Leave the diagnosing to people who are experts and who have received consent from the person on the other end, and we can use it to inform ourselves and to grow and to improve our relationships as opposed to divide and separate and attack. I'm Dr. Marcia Sirota. Please stay tuned for more videos on mental health and wellness.